Good afternoon. My name is Michaela Etheridge, and I'm a student nurse at the University of South Alabama's College of Nursing. And this is going to be my my initiating an IV saline lock video. So the first thing that I'm going to do is verify my order, verify my hospital's policy, and gather all of my equipment that I'll be using for today. Then I'm going to perform hand hygiene, and I'm going to verify that this is my patient using two identifiers. So we have Jaguar Jones, MR number 4176352, MR number 4176352. We're going to go ahead and assess allergies. We have allergies penicillin and allergies penicillin, and I would just get them to let me know if they had any other allergies that I need to know about. Then I'm going to close a door or a curtain to provide privacy. I'm going to position my trash can, perform hand hygiene, and don my goggles. Then I'm going to raise my bed to a working height and lower the side rail. I'm going to position the patient in a supine position or sitting up, whichever is most comfortable for them for this specific procedure. Then I'm going to open up my sterile packages on my bedside table and get everything organized without breaking sterility. So I'm going to open up my saline lock tubing. I'm going to remove my Tegaderm or my transparent dressing. I'm going to remove my chlorhexidine swab and my syringe. Now I'm going to just organize everything how I want it and make sure that everything is still sterile. Then I'm going to swab my injection cap. So I'm going to, with an alcohol swab, I'm going to grab my saline lock and I'm going to swab the injection cap. I'm going to place the syringe onto the end. I'm going to prime, and then I'm going to attach, and I'm going to prime, keeping the syringe attached. And then I'm going to loosen the cap, and so it's easier when I need to attach it. And now I'm going to place it back into its sterile packaging. Then I'm going to open up my over-the-needle catheter from its packaging. And I'm going to remove my Tegaderm or my transparent dressing. And I'm just going to make sure that everything is still sterile and in the right place. Now I'm going to show you how to choose your vein site. So to choose your vein site, you're going to choose the most distal site. You're going to choose the non-dominant arm, if that's possible, and you're going to choose the largest, softest, bounciest vein. And then I'm going to 3 ways to foster venous distension is lightly stroking the vein, adding warmth to the vein so that vasodilation happens for a few minutes, and then you can also get them to ball their hands into fists if they're able to, and if they're not, then they can just put their arm in a dependent position. So now that I have chosen my site, I'm going to place my tourniquet 4 to 6 inches above the site. So 4 to 6 inches above my site. And now I'm going to put on my clean gloves. So now that I have on my clean gloves, I'm going to move my saline lock on my bedside table a little bit closer, making sure it's still sterile. And now I'm going to clean my site that I have chosen. So I'm going to get my chlorhexidine swab, and I'm just going to clean using friction. I'm going to clean vertically for 10 seconds, horizontally for 10 seconds, and in circular motions for 10 seconds. For the least amount of time is 30 seconds, so you're going to just clean for at least 30 seconds, vertically, horizontally, and in circular motions, making sure not to touch where you have just cleaned. And now, since it's clean, I'm going to wait for it to completely dry, and then I will begin. So to begin, inserting the IV, I'm going to first anchor the vein. So I'm going to anchor the vein by stretching the skin. I'm going to anchor 1.5 to 2 inches below the insertion site. I'm going to I'm going to pull the skin away from the site of insertion. So I'm going to be pulling down, and I'm going to be pushing the needle in. So I'm going to make sure not to touch where I've cleaned or my insertion site, and I'm going to get my over-the-meter catheter, and I'm going to, with the bevel up, I'm going to insert at a 10 to 30 degree angle, making sure not to touch my anchoring thumb with my catheter. So I'm going to insert 10 to 30 degrees parallel to the vein. And I'm going to tell my patient that they need to be very still. They're going to feel a slight stick. And then I'm going to assess for blood return. Once I get blood return, I'm going to lower the needle. And I'm going to insert another 1/4 of an inch. After I have done that, I'm going to, while still holding the skin, I'm going to advance the hub. I'm going to advance the catheter all the way to the hub without advancing the stylet. Then I'm going to, while stabilizing the catheter, I'm going to pop the tourniquet. I'm going to put pressure 1 1/4 inches above the insertion site. I'm going to remove the stylet, place it in my sharps container, and I'm going to quickly remove the top from my saline lock. I'm going to quickly attach it to the catheter. Then I'm going to temporarily tape that. So I'm going to temporarily tape. And then I'm going to aspirate for blood return once again. And then once I get blood return, I'm going to flush the vein by inserting the rest of my saline. Once I have inserted the rest, I'm going to remove the syringe, and I'm going to place it into my sharps container. Now that I have placed it into my sharps container, I am going to apply my dressing. So I'm going to grab my transparent dressing. I'm going to open it, making sure not to touch the inside and only touch the outside. I'm going to place it above the hub, making sure not to cover the connection site. So now I have my transparent film on, and I can now secure the IV and the IV tubing with my permanent tape. So I'm going to remove my temporary tape. And I'm going to get my new tape. And I'm going to let the tube assume a natural position. And I'm going to tape. And I'm going to make sure not to tape over the transparent dressing. So now I have it taped and it's and everything's done. Now I can dispose of my garbage and remove my gloves. Now that I've removed my gloves, I'm going to label. So to label, I'm going to get my label. I'm going to write the date, the time, the gauge of the needle, and my initials. So we have the date, time, the gauge, and my initials, and I'm going to place that on the edge of the transparent dressing. So now that I have done that, I am going to position the patient into a comfortable position. I'm going to lower the bed and raise the side rail, and I'm just going to make sure that the patient is comfortable. Then I'm going to instruct them on ways to prevent dislodging of the IV, and I'm going to teach them the signs and symptoms of IV-related complications, which would be phlebitis, infiltration, and inflammation. So, and I would get them to call me or another nurse if they notice any blood on their dressing in their tube, or if they notice that their fluid stopped or was very slow. Then I'm going to perform hand hygiene, and I would leave and I would go document. So I would document the date, the time, the location that I placed the IV, the number of attempts it took, the catheter gauge and length. I would document patient tolerance and the presence of a saline lock, or the flow rate and method of infusion if there were any fluids. So now that I'm done, I'm going to, I would normally remove the waterproof pad, but I'm not going to do that today because I'm about to show you how to discontinue. So I'm just going to move this closer so you can see. Okay. So now I would come back, and using aseptic techniques, I'm going to discontinue the IV. So I'm going to perform hand hygiene, and I'm going to put on some clean gloves. So now that I have on my clean gloves, the first thing I'm going to remove the old transparent dressing. So I'm going to make sure to pull towards the insertion site. And I'm going to get a sterile dry gauze. I'm going to place it right above the insertion site. I'm going to remove the old tape. And I'm going to steadily and slowly pull out the catheter and discard of it in the sharps container. Sorry, the tape was a little stuck to me. So I've discarded in the sharps container, and I'm putting pressure on the site for at least 30 seconds, and if my patient was on coagulants, then I would hold for at least 5 to 10 minutes. So I've held, and while pulling out, I forgot to say, so I pulled it out slowly and steadily. I forgot to say that I would pull it out parallel to the skin, but I did. And then I put pressure. And now I'm going to observe the IV site for any signs of IV complications, which would be redness, pain, tenderness, swelling, bleeding, or any drainage. And I did not see any of that, so I'm going to get a new sterile gauze. And I'm going to place it on the site